You are listening to Diagnosing TV, where we will talk about medicine through the lens of different TV shows and decide whether they took too much artistic license or they have a license to practice. Hello listeners, my name is Madhu Karthikeyan. Thank you for joining me here today on another episode of Diagnosing TV. I wanted to create a podcast where I could talk about my two favorite loves, medicine and TV shows. So throughout the show, my goal will be to extract medical stories that run through some of my favorite TV shows and understand, with the help of some experts in the field, if the show is successful in portraying these medical stories or if they took too much artistic license. On this episode, we're going to be talking about the show Never Have I Ever, an incredibly important show because it is one of the first steps in expanding the representation of South Asians on TV. To help me dissect the medical storyline, I have a guest on here today, Dr. Tina Mistry. She is a physician in the UK whose expertise is in mental health, particularly in regards to the South Asian community. Thank you so much for being here today, and I wanted to let her introduce herself.
Hi, Mother. Thank you so much for having me. I am a clinical psychologist with over 10 years experience. Could have added a few more years, but I'll go with 10. Working in the UK. So I've worked in all sorts of sectors, including our National Health Service. And now I work in private practice. And since sort of leaving and jumping into private practice, I've dipped into all sorts of things. So I specialize in working within South Asian mental health. And since that, I've also developed a network for South Asian therapists called the Brown Therapist Network, which is an educational platform to help inform South Asian platforms across the diaspora, across the world. So we're connecting with Indian therapists, we're kind of connecting with therapists all over the world, which is awesome. I also founded another platform which is called Another Mother Story, which specializes in South Asian maternal mental health, which is something that's very close to my heart because I am a mom of two. And that platform is specifically around using creativity to help mothers to heal from, any of their traumas that they may have experienced, and also a place where they can find sources of support through creative writing. And we are due to publish our first book in hopefully May next year.
Oh, that's great.
Yeah, so I'm a busy lady.
Yes, you are. You also have a podcast and an Instagram. I believe it's the Brown Psychologist, correct?
Perfect. Yes. And the podcast is called Brownology. Yeah.
Awesome. So everybody go check that out. I will have everything on my social media as well. So before we proceed to the rest of the show, I wanted to put out a spoiler alert for the entire series because we will be talking about it in its entirety. And I would also like to place a trigger warning here because we will be talking about trauma and death and grief. So without further ado, let's get into the nitty-gritty details. First up, a quick summary. Never Have I Ever is a comedy that centers around a teen named Devi Vishwakumar, played by Mistry Ramakrishnan. The show begins a couple weeks after she loses her dad and experiences a traumatic event where she is about to dive into a pool, but can't because her legs are paralyzed. This might not seem like a funny premise, but Mindy Kaling, the writer and creator of the show, does a great job of taking this character into pretty funny situations. So first, I wanted to ask, what was your experience watching the show?
When I first heard of the show, I was so happy because it was about time we start to see South Asians, and in particular South Indians, on our mainstream TV. And as I started to watch the season and each episode, I was hooked, I was gripped because the storylines were so complex, but also really kind of light at the same time. And I think Mindy Kaling did a brilliant job of kind of going deep, but then returning us to the surface. And I think grief and loss is such a powerful and universal experience. So she did a really good job by bringing the audience into the conversation or into that space with Devi, with a kind of a plot line around that. All of us will at some point experience loss in some form, and we will experience grief as a natural consequence. What we see in the kind of initial episodes is her response to grief, and how as an individual there is what I would class as suppression of emotion,
Right.
which may be the consequence of her having a physical response to the grief and loss, which is obviously the paralysis to her legs. It's a fascinating idea, because I don't think that, you know, if she had gone and done the storyline of what I would class as traditional or kind of normal grief, it wouldn't have felt as gripping. But because she had paralysis, it was more kind of like, whoa, what just happened here? Like, wow, does this even happen? And actually, yes, it does happen. And I was only just talking about this not so long ago, about how actually South Asians in particular, maybe even ethnic minorities, how do we process our emotions, these extreme emotions, which is what I guess Devi was experiencing. That what she had been taught, and this may be not a conscious teaching, an unconscious teaching from her kind of caregivers, is of the repression, the pushing down of her emotions.
Right.
And you can see that in her behavior, her kind of laughing things off, not addressing it.
Making jokes.
Absolutely. This real sort of, I'm not going there. I don't want to talk about dad. It wasn't a thing. Let's not go there. And that is such a typical response for many of us. And as the sort of season progresses, we start to get to know Devi so much more. We start to feel her pain as she starts to explore it. And what I loved, she was seeing a therapist. As reluctantly as she was seeing a therapist. And what a powerful relationship she had with that therapist, because what Mindy Kaling helps us to realize is that therapy isn't stale. It isn't this sort of white middle-class person that's sat in front of you, often a man, who doesn't understand your world. What she describes and illustrates is that therapy can be hugely nurturing, hugely normal, and really healing, but in a way that can challenge us. So it's a great, I found it really helpful. There were certain aspects that I thought, okay, some of this is obviously made to, jump out at the TV in a way that as audiences we're like, oh, okay, that's a little bit extreme. But that's TV. It can't be perfectly, I'm using air quotes here, normal, because normal would be,
we're not looking
not
for a
great
documentary.
For TV. Exactly. And I think that she did a great job with all of the characters as well.
Yeah, I agree. As I was watching it too, I experienced a lot of the same things of like seeing a darker skinned girl on television for the first time. Really, it was really nice to see a whole family, a whole cast of people who never really condemned therapy. There are a lot of TV shows where characters are like, oh, I don't really believe in it. Oh, I don't really want to do it. Even in the context of like couples therapy, maybe one person in the couple doesn't really want to go into couples therapy. And it's always seen as some sort of weakness to have gotten to that place. But I don't recall any of the characters really condemning the fact that Devi was in therapy. Maybe that's because you are dealing with a more drastic emotion of grief than maybe just regular mental health. But we will also talk about the other characters and see how we can normalize therapy going forward, maybe for not just for people who are going through this really intense emotion, but any kind of emotion. But let's also start getting into the paralysis a little bit more. So, according to the Mayo Clinic, conversion disorder is also known as a broader and newer term called functional neurological disorder. This features the nervous system symptoms that can't be explained by a neurological disease or other medical condition. However, the symptoms are real and they cause significant distress or problems functioning. And although they don't outright make this diagnosis on the TV show, would you say that conversion disorder, or as you said, um, as we were talking before, medically unexplained symptoms or somatic disorders, um, what that's what she's experiencing?
Yeah, 100%. That this is real. It does exist.
Mm-hmm.
And I think the difficulty we have as a society is that if we can't explain it, then that's weird. But actually, we've still got so much more to understand about the body. We've only captured and really understood a very small fraction of how the mind-body connection works. We're only just starting to understand how the mind-body connection works.
Mm-hmm.
Prior to more recent research, we were convinced that they were two separate entities. And actually, what we know is that the way that the body and the mind processes emotions is very different, and it's very complex as well.
Mm-hmm.
We've got now medical practitioners like Bessel van der Kolk, Gabor Mate, who are talking about these issues of how trauma is held within the body. It's not just the mind, it's actually within the body. And if we take Devi's example, that response, that loss was a traumatic response. So the loss
Mm-hmm.
of her legs was that how she had processed or was processing her loss.
Right. Yeah. Yeah. And, you know, as I was watching the show too, I realized, a lot of my experience with um, my mental health, that it does manifest physically so many times. And sometimes I don't even notice until much later on.
Mm.
If I'm, there was a time when I was very, very down and upset, and for a long, maybe almost a week, I did not feel physically okay. I felt pretty sick and didn't realize maybe months later that those were physical symptoms that were manifesting. So yeah, that is incredibly interesting that there is very little research on that, but that seems almost so obvious as we're experiencing our emotions, that of course they're going to be affecting our body, but hopefully more research continues on that. So how would you go about treating something like this, something that is not physically explainable but is also physically explainable?
Mm. So for most people, their first port of call would be their doctor, their medical practitioner, their GP. And
Mm-hmm.
that is where we would always recommend you first go to rule out anything that is physically treatable, anything underlying that we don't know. Then after that point, we would be looking, okay, if we can't see anything that is obviously treatable through a medical intervention, then we would look at a psychological intervention.
Mm-hmm.
And this is where we would be using our typical psychological treatments, like just simple talking therapies, counseling skills. We would be asking around the history around what the person has experienced. So in Devi's case, her trigger would be the loss of her father, and we would help her to feel safe enough to address these difficult emotions that she probably has locked away. And that is done really by allowing people to feel safe enough within their bodies. So one of the key things when we're working with people who have experienced a trauma is that people often feel like they can't express their emotions or talk about their emotions or even feel their emotions because they don't feel safe within their bodies. So the first step of any trauma therapy is to teach people how to regulate emotions. And that's a fancy word for basically feel.
Right.
Feel your emotions. Now, as children, what I find within certain families is that we are told to shut down our emotions, especially the big feelings like sadness, anger. That when we feel those emotions, our parents will be like, no crying, stop crying, stop getting angry, stop. It's often like this shutting down of emotions. Now you think years after years after years after years of being told that you shouldn't cry, you shouldn't lash out, you shouldn't express feelings. The only feelings we want are happy, happy. Yeah, no moping, no being miserable. So all these, what we call big emotions, they're not allowed, not welcome. So what do? We push all of that down and we learn that those emotions aren't welcome and that we shouldn't experience them and that they're frightening or they're scary or they're just bad.
Right. Yeah.
So actually, as adults, we stop feeling them because we're afraid of what they might do to us. And often many clients will say to me, I'm scared. If I start crying, I will never stop.
Wow.
And that's when we realize that that is because they don't know how to soothe themselves. So a lot of our work, especially within the trauma work, is we're teaching our clients how to soothe themselves. And it takes a lot of trust. It takes a lot of rapport building. It takes time for somebody to start to open up and feel safe enough to talk about how they feel. And one of the biggest tools that we teach them or give them is that they can soothe themselves. They can calm themselves down using various different techniques. Like one of our key tools is breathing, using your breath. That if we, and we all naturally do it as well, is that when we feel an emotion rise, many of us will unconsciously take a deep breath, breathe out.
Right.
Because what we're doing is we're pushing and releasing. Our breath is a wonderful tool. There are so many other types of tools that we would recommend, like touch. Touch is so wonderfully soothing. If you just give yourself a hug right now, put your arms around each arm, how comforting is that? And these are all based, and these are all easy tools that we can teach ourselves, but also within a therapeutic setting that we can learn to do, because they are human, soothing, kind of things that we do naturally. If there is a crying baby, what would we do? We'd pick that baby up and bring it close to our chests and hold it and soothe it and say, there, it's okay. And our tone would change, our voice would change, our body language would change, because we naturally know how to soothe each other. But sadly, because of life and society and culture, that we expect our children and even our adults to not express pain or distress, and we need to push it all down, put it away. But sadly, we know that that's not a good thing. We need to express, we need to soothe, we need to comfort each other. And that's what the therapeutic relationship starts off with.
I would imagine that course of treatment will also give patients such a sense of independence, because I feel like, self-soothing they can do by themselves. They don't have to, as much as it is important to have a support system, as much as it is important to have people you can talk to have that ability to soothe yourself, that must be so freeing as well.
That's the whole point. Yeah. We don't want people to be reliant on therapy. That's not the end goal. The end goal is so that you can go out and be a wonderful human being for yourself, but best of all, for other people too. So it's like passing on this gift of love, and it sounds so cliched, but it really is. It really is a really simple thing, but we have to unlearn a lot of bad habits that we have unfortunately inherited through no fault of our own. A lot of this stuff we didn't ask for. A lot of this behaviors our parents didn't consciously put onto us.
Mm-hmm. So you do talk a little bit about, like these things that we grew up with, and things that have definitely contributed to our development. Specifically about grief, how does that have an effect on early adolescent development? Because Devi has lost her dad at a pretty formative age.
Yeah. And I think that, being the teenage years, they are the most turbulent years, as we all know.
Mm-hmm.
To be able to have experienced such a profound loss. And, you can see through the season, the episodes depict her closeness, the relationship she has with her father compared to her mother. You can see there that her relationship is really fractious with her mom, and with her dad, it's this doting, loving father that she has, and he's no longer around. So who's got her back? For her to have experienced that at such a young age, of course, it's going to have an impact on her later development. That doesn't necessarily has to be negative, because what I want people to understand is that life is full of grief and loss and sadness and frustration. But what we need to take from those moments is, how do we grow from these moments? What has this taught her about human relationships? What lessons has her father taught her during that time that they spent together? And a lot of these ideas, they all lean back and nod to our philosophical and religious teachings. And if we just look at some of those ideas, that these sorts of ways of being, values, if you want to call them that, or teachings, help us to address what it means to be human. And it can be as complicated as you want it to be. It can be as simple as we want it to be. It really is about our understanding of ourselves.
Yeah. And I can imagine also that now showing like that the unhealthier responses and the more healthy responses in the show can also affect her going forward. That it doesn't have to be a negative impact on her entire life. Of course it's gonna have, she's gonna be struggling for a while, but it doesn't mean that it's gonna be bad forever. I can definitely see how that would be portrayed as well. So we talked a little bit about how in general how we are trained as to suppress emotion. How have you seen in your experience therapy being stigmatized in the South Asian community in specific?
Yeah, and I think it's so multi-layered. So first of all, going to therapy, like you said, it's a bit of a weakness. We don't go there. We don't talk about our problems. We don't air our dirty laundry to strangers. And I think that's one thing. So there is this sort of idea around keeping it within the four walls of the family home. There is this fear of the dirty secrets. And then there is this long history around sort of colonialism and how that has taken away different ways of healing that may have been quite natural to us, but then now having to adopt this very Western way of healing. That
Right.
therapy could be seen as quite alien to many South Asians. Sitting on a chair in front of somebody who's a stranger in this room and having to talk. Very different to what maybe our ancestors may have experienced in terms of healing. That healing was probably more of a collective experience. Probably healing was more of a holistic experience rather than an intellectual or cognitive
Mhm.
experience. So there are many things that there are truths in, but there are also lots of issues around, kind of the stigma issues and the taboo of addressing our problems so overtly.
Right. Yeah, that's so interesting that you say that because in my experience, I think a lot of people, when they talk about, uh, how mental health is talked about in circles of uh, the South Asian community, I often don't find that mental health is stigmatized, but that therapy is. What I
Mm,
mean by that is, I guess, is like, when I'm talking to family members or family friends, often there's a lot of emphasis on mental health and having a good mindset and spiritual relationship with God or whatever it be, an emphasis on mental health in that way. But often therapy can be this stigmatized version of maybe prayer, maybe spiritual guidance, whatever it may be. And I've actually only experienced this recently because I've only been talking about my mental health journey recently with family and friends. But it is so interesting to see that dichotomy that mental health is not very much stigmatized, but therapy is. So, do you wanna explain a little bit about why maybe therapy is more approachable to certain people than other aspects of centering oneself and becoming in touch with their mental health?
yeah, and you used a really interesting phrase there, centering oneself. If you think about our, you know, grandfathers and grandmothers, they never thought of themselves as an individual. We come from
Mhm.
collectivist cultures, right? We believe that we are part of something. And to then go and take yourself away and then go and speak about something is quite bizarre.
Mm.
And that's where I think that family therapy or systemic ideas around therapy are probably far more better suited to collectivist cultures, because what we're looking at is the collective system, the system around the individual. So it's not about placing blame or placing responsibility on an individual. It's more around looking at what are the factors that are driving, that are supporting, or are perpetuating the problems within this system, because that's what we know, is that it's never in isolation. So that's where we get stuck, is that often therapy is seen as a very individualistic, self-centered space. And
Right,
it
right.
comes from Western ideology, comes from the Western models of illness, that
Mhm.
it's based on one person and exists within the person, when actually, if we scale that back and kind of zoom out away from that, we know that we live in societies, in cultures, in communities, and that often, and this is something that I see pretty much every day when I'm working with clients, is that problems or issues or distress occurs between people.
Mm.
And it's that space in between that we're trying to resolve. Yes, okay, we're working on how the person can help themselves, but often it's to do with, oh, my mother this, oh, my father this, oh, my husband this.
Right, right, right.
So therapy as a intervention may not necessarily be the most appropriate for situations or issues that are around collective or kind of family systems. And that's where I often see that tension apply. But that's not necessary to say it's not suitable. I'm saying that it might not be just the only one approach. There may have to be varied interventions or varied ways of helping people to heal.
That's so interesting. Yeah, and I also think as, a person who is an immigrant, um, and is part of the diaspora in America, we have this unique perspective of experiencing that collectivist society with, family, friends always, being on board for babysitting, never, having this sense of asking someone to babysit your kids, but offering, that sense of community was almost automatic when we moved to America, and also experiencing this, rejuvenation of self identity, and being selfish and understanding that you are a person who is allowed to take space. I think having that unique perspective of both of those things has definitely led to my decisions, about getting therapy and how it has affected my life, and also, my more spiritual, maybe, ways of again centering myself, and understanding that way through, maybe my more, um my family members or family friends who have talked to me more about that spiritual side. So yeah, that is so interesting. I'm actually learning a lot about, like, just my journey. um but yeah, that's so interesting. And you talk a lot about how therapy uh is a way, but is might not be a way for everybody. But oftentimes, I think we're hearing more often now, with mental health really centered in the news lately, that, a form of therapy can help anyone and everyone. And a lot of the characters on this show are dealing with some kind of trauma, whether it be, coming out to your family, having your mom abandon you at a very young age, your father passing away, whatever it may be. How can we begin to normalize therapy so that people don't feel like they need to lose a loved one or have severe depression, in order to want to have a therapist?
I think that is almost happening already, because what we're seeing is the rise of what I would call softer approaches to therapy. And I don't necessarily mean that coaches are therapists, they're not trained therapists, but coaches are almost kind of on the other end of the spectrum. They almost seem like you could go to them because you want to get to somewhere, right? You want to move
A
to
goal.
yeah, absolutely.
Yeah.
So when I look at a spectrum across the helping professionals, if you want to call them that, the
Mhm.
coaches are almost like this way in to experience having somebody to talk to about certain things. And I think that naturally you will start to reflect, because that's what you're there to do, is to think about yourself and think about your situation and think about your goals, that you'll start to piece things together. And the coach's job is to help you to reflect on those things, but to help you move forwards in a more kind of proactive way. And a therapist's job is to help you to heal wounds, to help you to kind of do that deeper level of work. And this is where the blurred line stuff happens. So we've got to be very, very careful. And this is where we want to educate consumers in knowing where, if you start to notice that there are, I'm using this idea around ghosts, that things are haunting you, there's things in your past that you haven't quite gotten over yet. So it could be the example of your mother abandoning you. If that keeps coming up in the conversation, you're just noticing that there is just something not quite right, where therapy comes very much into its own. And that coaching is essentially about helping you to shift in a kind of more forwards direction. And they do overlap, of course. But I think that the coaching professions are helping to and are inviting people into spaces where they can reflect and work on themselves, and can be a way into doing more of that deep dive when you get referred on to a therapist. So I see it changing. I do.
Yeah, that's so good to hear, because you hear a lot, especially recently with athletics, talking about Naomi Osaka and Simone Biles, and so many other athletes coming out and talking about their experiences, um, and how in the past maybe their coaches would have been like this is the goal, you have to do this, this is what you need to get that gold medal. Whereas now there's a lot more components in a coaching team that center more about, what do you want to accomplish overall. And I remember even Simone Biles talking about when she was experiencing that at the Tokyo Olympics, her coaches were the ones who supported her to make the decision and not compete, which is really nice to hear that shift happening in athletics. Okay, great. So we talked a little bit about this in the beginning, but of course, you said that the paralysis really emphasized to the audience how great her pain was, how it was not to be trivialized. The death of her father was of really a big impact on her mental health. But do you think that people would be more willing to accept mental illness as real if the symptoms were more apparent and physical in nature and not just quote unquote in your head?
That's a really, really good point. And I think that we already do that to a degree anyway. So when we think about mental health, most of us will think schizophrenia, psychosis, those extreme end of the spectrum when things are really entrenched. And we think self-harm, we think suicidal, we think, asylums, we think of all those old age ideas around what mental health looks like, and how sadly often these symptoms and these ideas within the media in particular are villainized, are often linked to forensic issues. So we have still got a long way to go in terms of mental health, because we are so afraid of that, the dark, the evil, as we would kind of portray that end of the spectrum to look like. And then what we're trying to now see is that actually mental health it's a spectrum, and illness is one end, like to be ill or not functioning is one end, but we can shift one to the other. I think we need to see more of what we would class functioning mental illness, which is majority of the population.
Right, everyday anxiety.
Yes. How do we show this? How is this portrayed? How is emotional distress expressed? And it's everywhere. If you look within your TV shows that you watch, if you start to see alcohol being abused, there is an underlying issue there. If you see, sleeplessness or insomnia, that usually is a symptom of an underlying mental health issue. So, and often these characters are functioning, and what we mean by functioning is that they go to work, they have children, they have families, they go to parties, they're doing all these things.
Right.
But they're still struggling underneath. And these are the types of things that we need to be addressing more and more. People that are like you and me, people that are taking antidepressants.
Right. Yeah.
But what we also need to see the backstory. So we need to see the backstory, which is the why. And that's where I think the gap is. The gap is that we don't understand why people suffer. What is the trajectory of this person's to where they got to, how have they got there, what has led them to take antidepressants on a daily basis, what has led them to become dependent on alcohol.
Yeah.
These are the things we need to start to show within, and then it's complex, it's not easy, it's not A equals B, it's never that simple. But we need to start to address that. We need to start to help people to understand the nuances around mental health, that attachment is a thing, that if we aren't nurtured as children, it leads to, and I know there are various films and various TV shows that do address this. But we need to make them more explicit. We need to have discussions like this so that we can show that this does exist, that it does happen.
Yeah, I guess, I mean, you really are just pointing out that there are so many signs to look out for, and often mental health is not as invisible as we like to say, I mean, even like there are physical symptoms like weight loss, hair loss, and fatigue. So yeah, I mean, alcohol abuse or insomnia, you're so right. There are so many symptoms to look forward for, um, that we shouldn't dismiss. And that's a great point. Do you also see that as there is a change in talking about mental health and in therapy is being less and less stigmatized, and hopefully going forward will be completely destigmatized? Do you see that more people, more families are going to therapy?
Yes, there is a huge shift. I've noticed it in the past sort of 3-4 years, that the idea around talking, the idea around struggling with mental health or emotions or whatever you want to call it, psychological distress, it's there. We're kind of placing it and no longer sweeping it under the carpet. And I think that's simply because we've got influencers like, Prince William and Meghan and, all our kind of, huge celebrities who are out there just starting to talk about it, saying, you know what, we feel stuff too. We're not immune to, like you said, Simone Biles and Naomi Osaka. They're great examples. The more that these influencers talk about these issues, the more that we kind of say, yeah, you know what, I do too. And the more that we address them within the media, on social media. I mean, social media is full of accounts that address these issues, which is wonderful. We're seeing a rise of therapists that are coming out of their therapy rooms and clinic rooms and talking about the stuff that we all need to be educated on. We
Meeting
all need
people
to be
where they
addressing.
are.
Yes. And I think that sadly, from the beginning of my career, that was just something that was never done. It was a bit of a ivory tower situation happening, that we wouldn't come out of our clinic rooms, that therapy would be for that type of person, that person who could afford it, especially private therapy. But now we're seeing more people of color going to therapy. We're also seeing more people of color who are therapists, who are doing therapy within their own way. Doesn't have to be using specific language. We're seeing that people can be anybody and they can have these conversations.
Yeah, and you speak of, it is incredibly important that we have more people of color therapists. I mean, a lot of my experiences and things I want to talk about in therapy are incredibly informed by my experiences as a person of color. So I mean, having a female therapist and having a person of color is incredibly important to my experience in therapy. So what do you think, as Devi Vishwakumar goes through therapy on television, what do you think the impact of seeing somebody that is darker skinned, that is a part of an entire South Asian family, going through therapy on television, what kind of impact does that have?
Yeah, it makes it feel less mysterious, doesn't it? It makes it feel like what actually happens in those sessions. People get to see like a fly on the wall experience of what therapy could feel like. And I love that. I think that that's really powerful. And I love the very gentle and relaxed nature of the therapist. Obviously, there are some boundaries that were slightly blurred where Devi just kind of walks in and, it's a bit like, there is a line. Yeah. But again, these are things that you would obviously address within the therapeutic context. But yeah, I think that for families who watch as parents, if I was a parent and I didn't know nothing about therapy, I'm like, oh, so that's what happens, kind of, sort of, it's not mysterious.
Yeah, because it's so interesting because you grow up watching so much of Western television, Western uh, cinema, and I've seen so many white characters in therapy. And I always kind of just thought of it. I kind of separated myself from that. I think maybe just seeing that as a portrayal of therapy instead of maybe what would actually happen in therapy, and seeing a teenager that kind of looks like me definitely I think will have a great impact on other people in our community who might have maybe thought about therapy, might have seen someone go through therapy, maybe had a friend in therapy, but never thought, I'm the person to be in therapy. And make it more approachable, more accessible. So yeah, I'm like I said before, very excited about this TV show. But at the end of the first season, you kind of see Devi come a little bit to terms with her father's passing away. But she has a lot to go forward. And in the second season, she does a little bit more healing, a little bit more um, therapy. Is there like you said before, you don't want people to rely on therapy or be completely dependent on therapy. What is exactly the end goal?
So goals are often a collaborative decision that is
Mhm.
made between the patient or the client or the person and the therapist. Um, and the expectation is that it has to align to values that the person believes in. So if we take Devi, for example, one of the things that we would be very mindful of is that she doesn't develop a dependent relationship on her therapist because she has experienced that loss of her father. And clearly the therapist is doing a great job of providing that safe space for her. So you don't want Devi to become totally, reliant on her therapist. So it
Mhm.
may be that the therapist's job is to address that, is to gently address what this relationship is about, the therapist relationship, and how they feel about it, what are their worries, what are their concerns, and the therapist would, gently address these issues too.
Mhm.
Um, if they become kind of an issue, I guess. So it's really important for the therapist and the person engaging in therapy to address the elephant in the room often. Because again, what happens is that we go into patterns of enacting relationships. So, it's very important for the therapist to be in tune with what's happening and to address them appropriately.
Mhm.
So, we've got to just address what the issues are, what the underlying issues are, but also then to help the person get to a place where they feel like they have achieved something, they have achieved a specific goal, or they are moving in a direction where they can function in a way that they may have felt like they weren't functioning before.
Mm. Yeah, I think that's, really portrayed in the second season where like she's trying to deal with her anger issues for the first time and coming to terms with the fact that her anger is affecting everybody around her, not just her and her actions. And her therapist gives her this tool to really zone in on like why she is feeling angry. Is she hungry? Is she alone? Is she upset about something? Is she tired? What is it exactly she's feeling? And I thought that was a great portrayal of a tool that therapists can give patients that they can carry on and use whenever they are feeling like that again. Um, but yeah, so that's pretty much everything I wanted to talk about Never Have I Ever. Hopefully you guys got a little taste of what therapy how therapy was portrayed on the show, and if you liked what you heard, you should go watch the show if you haven't yet, because it is a great show. And yeah, so that concludes this episode of Diagnosing TV. Thank you all so much for listening to us nerd out about medicine and the silver screen. I want to thank my special guest here, Tina, and you can find her social media info over on our Instagram page at Diagnosing TV. Uh, I also want to end this episode with a quote that perfectly captures this TV show. After Davy's legs become paralyzed, her best friend and robotics team captain, Fabiola, tells her, "One day you will walk again. If not, I will build you legs." Thank you, and until next time.